We're going to talk about group health options for business and how you can combine a self-funded qualified health plan with DPC and still save money.
Teresa, just a sound check. Can everybody hear Teresa?
No.
Yeah, may so
Speak up.
either we can sit down into the mic there and turn it on, or we can, there we go.
Is that better?
Yeah, there we go.
So the topics we're going to cover are the most important components of our healthcare, the business-employer relationship, that's what we're going to focus on, group health options, group health costs, the self-funding work, how does it work? Positives and negatives, self-funding, how do you combine self-funding with direct primary care? We'll show you a self-funding success story and how you get started. So right at the very beginning, Senator Colbeck went over this, you begin with the individual and the employee. And the very first thing that the individual wants to know is, am I going to get stuck paying an ACA fine? Does my insurance cover that so I don't have to pay that? What's my coverage? What's covered, what's not covered? Cost, out of pocket. What is the totals? Co-pays, co-insurance, deductible. What is it going to cost me? And can I keep my doctor? And then next you have the provider, facility, office. These are things that the provider needs. They need to have an office to work out of. They need to have staff, equipment, and supplies. They need to have a stable patient base that provides sufficient revenue to pay for all of this. And then they also need to be free from government oversight so that they can practice medicine the way they were trained to. And next you've got the business and the employer. What are the options available to the business to provide a low-cost coverage for their employees? What's it going to cost? What is the coverage? Because you've got to be able to maintain employees. So you have to have a good plan. And what are the positives and negatives of each one of these? So we're going to focus here on the business employer. Group health options. What we've always known in most businesses is the traditional, aka fully insured. A fully insured health plan is a more traditional way to structure an employer-sponsored health plan. With a fully insured health plan, the company pays a premium, and we all know this model. The company pays a premium to an insurance carrier who pays claims based on the policy, and the insurance carrier assumes all the risk. The other option is a self-funded, or it's also referred to as a self-insured, or a risk-based plan, where the employer is actually acting as its own insurer. For the self-funded health plan, the company pays claims as they are incurred based on the policy designed by the employer. The employer designs the policy, and the employer assumes risk for all future claims, but that risk can be mitigated by stop-loss coverage. So it's not all bad. And then we've got the traditional plan. This is, we're looking at cost. You pay the premium to the insurance company, just flat out every month. Premium rates are fixed for a year based on the number of employees, but it goes up every year. And the policy must cover essential health benefits, which increases your cost. And they pay a premium tax. Business pays a premium tax every month when they pay the premium. This is the highest cost, and there's absolutely no possibility of return. You're not going to get any of your money back. With a self-funded ERISA plan, the employer is acting as its own insurer. Payment is based on actual incurred claims. So you're not paying a premium every month. Your payment is based on what is actually incurred by your employees. There's an additional benefit cash. Additional benefit cash is held. So if you've budgeted cash for health care, that money can go into a bank account and can be collecting interest. The employer designs the policy based on need and cost, and they don't have to include essential health benefits. So that can reduce your cost, and then you can leverage that between what the employee has to pay and what the employer is paying so that it works out. The premium tax is completely eliminated, and you can purchase stop loss to limit your risk. Okay? This is potentially a much lower cost with a very high chance of return, and we'll talk about that in a minute. So in the traditional, aka fully insured world, this is what you experience. You have 100% non-refundable premium. This is a group of 112. This is a group of 112 people. And what the company paid was $970,000 in premium. The claims expense that was actually incurred by these 112 employees was $690,000. So the insurance company basically kept $280,000. Total premiums $970,000. In the self-funded world, in that same scenario, you would have expected claims is the blue, which is $690,000. The stop loss, what you would pay to mitigate your risk, is $130,000. You've got $30,000 in administration, your third-party administrator, which is who handles all your claims. And you total that up, and you have an employer savings of $120,000. So the total paid out is $850,000 versus $970,000. So you've managed to keep $120,000 of your own money. Okay. And what are the positives for fully insured? Well, the big one is it's predictable premium. You know exactly what you're going to pay. The problem is you're going to be paying more every year. And the other positive is that there's no risk. The insurance company is at risk. The negatives are you've got a limited plan design. The insurance company says, here's your plans. You choose which one you want. You have to include state mandates, which are all your essential health benefits. Paying a premium tax. There's no cash flow advantage. You pay that money out every single month. And there's no benefit for lower than expected claims. Doesn't matter if you have, low claims one month, high claims the next month, your money's gone. With the self-funded, the positives are, you see there's a whole lot more. Your risk is limited with stop loss coverage. So and stop loss coverage works as you can do it as a single or you can do it as an aggregate. So you can say you set your stop loss at $100,000. So if you have one person that has an extraordinary event, emergency or something like that, the most the company is going to pay is $100,000. So it limits your risk. Then you've got cash flow. Claims are not funded until they're paid. Advantage, when claims are lower than expected. You have $10,000 one month, you have $20,000 the next month, you're keeping the money. There's no penalty, there's no premium tax. You keep that money, the long-term lower cost. Negatives, cash flow fluctuations is one of the big ones. But as I said, you have the stop loss to help mitigate that. It's not for the weak of heart. There is some risk involved, but again, that's mitigated by stop loss. It takes time to develop. The first year, they say that it takes anywhere from 3 to 4 years to really see the full benefits of self-funding. Okay, so self-funding and direct primary care. The most important part of any self-funded plan is to control claims. That's huge. The more you keep the claims down, the more money you save. The most effective way to do this is through the use of free market solutions, which includes direct primary care. And these are the benefits. Direct primary care, it lowers your entry-level threshold for self-funding, so startup is easier and less costly. Okay, so right out of the blocks, if you have your employees that are signed up for direct primary care, office visits are included. So if you're paying a $49 or $59 or whatever the monthly payment is, all those office visits are included in that. So right out of the blocks, you're saving a lot of money. Utilizing a DPC provider reduces unnecessary utilization of hospitals, ERs, and specialists. And you can just go right down the list. Because the employee is coming into the doctor more often. They're not having to pay that high deductible copay, co-insurance, deductible. They're not having to pay that. They're paying a low fixed monthly fee and everything is included. So the chances of them developing a more chronic condition or needing those emergency services, those high price services, is much lower. DPC traditionally offers more in-house testing and procedure options, thereby reducing costs. Again, You get your CBC in the office, you get your x-ray in the office potentially. There's a lot of that is included. So we've reduced costs tremendously. Okay, this is a success story. This is Palm Beach County Fire Rescue. This is in Florida. They were established in 1984 with a merger of 8 fire control districts. They had approximately 400 employees, and they started with seed money of only $300,000. They had a lot of challenges to start out, and they admittedly said that the biggest challenge was ignorance. They really didn't know what they were doing. They didn't know how to set up the plan. They didn't know where to go. So flash forward 32 years, so they've been in it that long. Family premium for this group is less than $300 per month. That's family premium is less than $300 per month. Their rates have not risen in over 10 years. They have a phenomenal benefits package. And one thing that was really interesting on this is that in their benefit package, and this is something that I have never ever heard of, they provide, and this is at absolutely no cost, they provide stem cell storage. So every single person that is a member of that plan, from newborn on up, they actually give stem cells, and those stem cells are stored for 16 years because it's been proven that if you develop a chronic condition later in life, your own stem cells are the best way to treat that chronic condition. So this is something that's offered at absolutely no cost. And they continue to add benefits and grow reserves, and the reserves are to a level, their reserves now are to a level that they don't even have to have stop-loss insurance. That's how much they have in reserve. They struggled for a couple of years in the beginning. They had to make sacrifices. They had 8 different companies that they were bringing together that they had to merge their plans. And so it took time. They had to sacrifice. They had to decide how they were going to work it. But they did it, and they are so glad that they did. So where do you begin with all this? Plan 1 year in advance. Everyone recommends that. There's so many moving pieces to self-funded insurance, and it takes that long to put into place. Best advice I can give is to hire an independent TPA. Put a lot of work into finding that good TPA, because they're the ones that help you develop your plan, that help you leverage your stop loss so that you know exactly what you have to have so you're not paying too much. In the end, they adjudicate your claims. They look at all of that. So find a good, independent, transparent TPA that will let you audit the claims, let you see what's actually happening. And then audit risk data. This is extremely important. Most insurance companies, if you're going from a fully insured, won't let you see it. They just absolutely will not. But if there's any way to get a hold of it, because that's the best way for you to know how you have to develop your plan and how much it's going to cost you. And then the last one is to develop a good, solid plan and to combine direct primary